Thank you for this question because this is, my favorite question. So CT, as I told you, I did not know anything. So I went through the program. I was told I have to take the CT, so I took it. But SCT is different. So, after taking CT, as I told you, I was in the academic side. I did not work in the clinical side at all. So I became a faculty. Now I'm a program director. I was having CT only, and then we started transitioning our program to master's degree. And then I came to know that, they can sit for SCT. And then I started thinking about, what, I don't have SCT. So, even though I'm confident that I can educate the student, I personally felt that I needed SCT just to make myself more confident. And also, I don't want anyone to ask me that, you don't have an SCT, how are you training the students? Also, I need to know what the exam process is because I need to advise the students. So that is why I took the SCT. And then last ASC meeting, I went there. So I met some of the individuals that is associated with ASCP VOC committees. I had a lot of encouragement, motivation from them. And personally, being a program director, training the students for SCT, I think I need to take SCT. So I took the SCT. And then I got the certification. Now I feel very proud, more confident in training the student because I know the process, how it works. And, so that's my experience. Studying is very important. And, that is why even during the orientation of our program, we tell the students that, we will be training you for your board exam from day one. However, it is your responsibility to put more effort on studying. And the other thing is, a lot of the things we study theoretically and which you may get in your board of exam, you don't see in the clinical practice everyday screening. So especially when they are spending like 8 weeks and 12 weeks in clinical rotation, they may not see most of the theoretical stuff we study in the program. So they need to take more time in studying. And then that is why we do the last 2 weeks of review to kind of completely focusing on the board type questions and multiple choices questions, images exams. We do lots of review with the images. That is important. Studying is really important from the beginning. Is very important, not just the last 2 weeks to study and then you will not be ready for your board exam if you are thinking that last 2 weeks review is enough. So from day one. And we encourage them to study with all our exam questions and answers and reviews. And holiday book, I think I used it, and we encourage the students to use the holiday book to prepare for the board exam. And ASCP practice tests were wonderful. Most of our students they took it and they said it is really good in preparing them. Those are some of the additional things I would say to prepare. So yes, studying from the beginning is important. I'm sure, other programs does the same thing too. We emphasize the importance of the board exam from day one. Maybe we are emphasizing more, I don't know. But I don't think we are doing anything different or special. I would believe all the program directors and all the programs would do the same thing too. So again, more reviews. We have lots of reviews. For example, if they go through the lecture of breast FNA, I do an image review of breast FNA. So lots of reviews. And the more they look at the images, they think through it, and that is why they are getting more confident in answering the question. And we also do lots of games. I don't know how other programs are doing, but we do like Jeopardy and all sorts of things to be interactive. And also, that is an anonymous census. If you do like a group discussion and image review in the classroom, some students are more prone to answer, some students are very quiet, and some students, struggle to speak in front of the peers. But these type of answers, it is an anonymous answer, so everybody answers and learn from everybody. So I think that is one thing we have been trying to increase in our program. Lots of interaction, anonymous answers, games, that kind of helps. Students are very happy about that. There is a trend change in students' expectations, and we have lots of non-traditional students coming into our program. Nowadays, students don't understand how much time they have to put in preparing for these exams. That is one main thing I'm kind of saying. So that would be an obstacle for some of the students, because they have family, they are working on top of going through our program, and with all the requirements that needs to be done for the program. And board of exam preparation is, you need to do more additional to what you are doing in the program. So I don't think they are having enough time. That is the main thing. So the family support, your financial support is very necessary for many of the students going through our program. So that is why we kind of educate them from the beginning. So these are all the things you may see later on when you are nearing the board exam. So to avoid that, try to schedule yourself some time from the beginning, and then try to plan when you are going for clinical rotation. You're spending 8 hours in the lab during your clinical rotation. When you come home, you need to take care of your family, and you need to take care of you, because you need to be well to go through all these things. So time management, that is very important thing. And then we also bring experts in our program to talk about test taking strategy. And so like 1 hour lecture or some just a discussion of they give some advices how to prepare you, not just 2 days before the exam, but like 2 months before the exam, so that they can adapt to all those kind of changes and prepare themselves. So that is one obstacle I see in the last few years, like time management and family and job pressure. I think yes. So in this digital era, they are very quick. They keep their calendars in their phone. So we see a mix of students. One who is kind of a very digital friendly, one is one paper friendly, those kind of things. So again, not traditional students, mixed type. And the other thing I see is like they need the answers immediately. They cannot wait. There is no patience. There is no patience. When we say do you want to first look at the book before we discuss? No, they want the answer right away. The concentration has come down a little bit. I think we have national data on that too. So it is really difficult now to have like a 1 hour review session continuously. So that is again because of distractions, social media, I guess. I don't know. The concentration duration has come down a little bit. So family support. When I took CT, I had like 2-year-old daughter. So my husband is my inspiration. So he is an associate professor here in the University of Nebraska at Omaha. But he is the one who encouraged me a lot. And then, when I was doing schooling and board exam, and he took care of all the household chores. So that I can concentrate on studying. So again, being from India, we don't have any family here in the United States. So it is just our family and friends, of course, but family, it is just us. So, he took care of everything. And then when I took the SCT, I was a full-time program director. I had lots of committee assignments and everything. So I have to still kind of prepare for the exam too. I have to prepare too. So again, at that time, my daughter is in 11th grade now, so junior, so she's an inspiration too. So great family support. I'm very blessed to have my family support. So again, I can learn a lot from my daughter too. That's my support. And of course, when I took my CT, our program director, Dr. Amber Donnelly, I learned everything from her. She is still my teacher, even though I don't work very closely. She is an associate dean now in the college. She will be always my teacher. I learned everything, and I still learn everything. Every time I meet with her, I learned something from her, and she encouraged me, supported me, and she provided, like the way I do for the students now, all the reviews and everything. She did the same thing for when I was a student. Definitely Dr. Donnelly and my family, my husband. I am very happy, proud, and my confidence level has increased a lot after taking SCT. With no doubt, I can say that, I can encourage my students to take SCT, and I can talk to anyone about the importance of SCT or CT, both. The confidence level, that is number one, I would say. So it is really increased. It is the highest priority, I would say. So if I am an employer, if I want to hire a cytologist to take care of my student, my patients, I wanted to know that that particular cytologist is validated again. And that is what BOC is doing, making sure, the graduate is ready to work as a cytologist in the healthcare profession, and that is important. If I think I am a patient going to a hospital, I wanted to know whoever is treating me, whoever is related to my treatment process or anything should be a validated person. So, I don't want anyone to just having an experience and treating me. So I want somebody to say, okay, they are good to treat you, or do anything that is related to your health. So I think in both the places, that's what I want as a patient, as an employer, and as a lab professional. That again, getting certification would kind of increase your confidence, and you can confidently do your job to treat the patients. So I think it is important in everybody's point of view. As I said before, one, my confidence. The other thing is I feel like if we have the SCT, the students value you more, to have their confidence have increased, this is the good program to be in, those kind of things. And even, not just SCT, CT too, if you have a credentials, I think that increases the value of yourself. That not only gives you confidence, and also confidence for the students who you are having. And you are a role model. So I think it is very important to have that, to increase the confidence for the students too, and make them aware. Definitely, my 100% support. I would encourage, and I would definitely talk about the value of, taking SCT. And, the other advice I would say is, again, even if you're working as a cytologist, you need to go back to your book, read the book and look at the topics that are covered in SCT, because ASCP has a, detailedly say, this is the component for this particular topic, those kind of things. So look at it first so that you have an idea of where to concentrate more. And then, all the resources. When I took SCT, I saw ASCP, that are lots of links and, wonderful resources to take it. So make use of all those things, because some of them are not even aware of all the resources, given in the website. So recently I had a graduate, asking me that, saying that she is preparing for SCT, what can we do? How can she do it? So I suggested the same thing. So open your book, because in the clinicals, you may not have seen very many things that is in the theoretical, side of the book. So open the book and go to website. I gave the link to her. There are lots of resources, lots of books in there. So again, checklist is very, very important. Those are the advice I would give. And then I would say, definitely block out some time just to study for the exam. Even if you feel like everything, but still block out some time every day to open your book and study till you take your exam. And look at lots of images, lots and lots of images. That is very, very important. So you may know the criteria of any kind of disease, but you need to interpret that when you're looking at the image. So that is very important. And the image too, higher magnification, lower magnification, all those things comes, you need to be prepared of. Not like just beautiful images, straightforward images. No, little bit of, subtle images, kind of hazy images. You need to prepare for everything to be ready for the board exam. So images are really, really important, I should say. I give the advice to the students too. So even with the books, close the answers, just look at the image and kind of, do self-assessment. So that is important. I 100% supported the new name, cytologist, because we do a lot of stuffs now as a cytologist than just being in the lab preparing slides and looking at the slides. So we do grossing, we do digital pathology, we do flow, we are involved in several other ancillary techniques too. So it is not just a technology part. We are a well-rounded people, so doing lots of additional needs for for the healthcare. So I think the cytologist name kind of gives you a little bit more lift and tells the public that we are not just in the lab behind the microscope. We are doing lots of other necessary things too. So I think that name kind of gives you a little bit of more, again, confidence, I would say, more happiness, and I don't know, but I think that just tells the public that we are not just in the lab and behind the microscope.